Good afternoon, everybody, and happy Tuesday. Welcome to this week's Practice Accelerator Challenge. I'm here with the lovely Chanel. How's it going, bud?
Good.
And our fearless leader, Reagan Archibald. I'm going to hop into some announcements before we get going with today's webinar. I just wanted to remind you that session 2 is coming up June 3rd, June 4th, Salt Lake City. Be there or be square. It's going to be a great event. We're going to be talking about the innovation of medicine. So with that, we'll be diving into like the materia medica innovation or innovative medicine, applied science, longevity. We're going to be doing a lot of focusing on longevity this time around, which I'm really excited about. Where the future of medicine is going. We'll be diving a little bit into team culture and how to build and like cultivate an awesome team. And then we're going to be launching our new 3-day thyroid challenge, right, Reagan? Is that what it is? A challenge, I'm assuming?
Yeah,
and
we're going to be showing them how to do it. Yep.
Yeah. And then last but not least, we're going to be focusing on the pain ROF. So this will be really cool because it'll be pretty specific to pain patients. I hope I'm saying that right, but
yes.
I feel like that's something we all treat so often, and it's just something we all face as we age or get injured or do all the things. So having a nice like focused channel of energy with that corner of medicine, it's going to be really cool to learn about that. So, well, Reagan, take it away, bud.
Okay, well, today we're going to be talking about the future of your healthcare practice, like what it's going to look like and the big opportunities that's happened, because there's been a tectonic shift in the consciousness around healthcare. As you guys could look at how everything was before 2020, that is the old way. And then during 2020, 2021, that's when we were kind of figuring things out. We're in this massive reset. And I think this reset has set the foundation and the stage for tremendous opportunities in healthcare that so many of us are capturing right now. And I'm going to share with you how you can best support your team and your foundation and your clinic so that you can maximize on the ability to help people now that they've had this fundamental shift in their thinking. Because how many of you have noticed there's been a massive change in healthcare? Have you guys noticed that, Annie and Shani? Like we suddenly view things differently.
Oh yeah.
What have you noticed, Shani?
Same. Well, I mean, once you're past the fear and the panic stuff we all went through, it's just this whole different, I mean, that we do have doctor's visits over the internet and everything has changed. I mean, everything is now virtual and moving that direction.
It's crazy, isn't it? And yeah, it's all virtual, but the other big shift I see is that there's not the people are not investing in conventional medicine. We now are skeptical of the medical system more so than we were before the pandemic, because it wasn't the virus that was the scary part. It was the government's response to the virus that was the scary part, right? And this colossal overtaking of healthcare is the real thing that's woken us up.
Yeah. I think it's been a really powerful shift. Like it's made us stop and like, I think back in the day, we just like blindly trust whatever the person in the white coat says, like, here's a prescription, here's this. But now it's forced us to take a deeper look on what medicine really is and what it should be, and focus more on healing rather than treating like a specific condition, or, band-aiding, I guess is a better word. So right. I think it's there was a lot of shit with all of that went on, but in it came something beautiful, like a great awakening in how people view and are approaching their health.
Yeah. I think people who are on the fence, all of a sudden now they are adopting these new philosophies, and they're looking now more than ever. I'm seeing people are willing to invest in programs. And it's a totally different environment out there. And so what we're going to talk about today is one simple thing that people want more than anything, and that's a trusting relationship. So we're going to be, we have this lifetime extension, these lifetime relationship programs, and we have a tool for that in session 3 that we've introduced. Today, I'm going to go and take it a little bit deeper, and we're going to be talking about providing a healthcare model of the future where the building trust and inspiration in your relationships comes first. And this is based on a lot of this is based on the new thinking that's coming out. But then what I've done is I've modeled it somewhat after Ritz-Carlton, Four Seasons, so that you guys can see that there's core principles that never change. But people in the past, they were used to just being put in line, being told what to do when it comes to their healthcare. It was pretty much like you could give the lowest level of service and people they would tolerate it. I don't know if you've noticed that, Annie or Chani.
Oh, yeah.
In the healthcare system,
Oh,
it's
yeah.
like, even in holistic medicine, we see people and Go Wellness. It's like, well, as long as people aren't yelling at me, I think we're doing okay. And
Totally.
that's the best way to put yourself extinct, because
Yeah.
the airline motto is we're not happy until you're not happy, right?
Yeah.
All right, and then Delta does pretty good,
No, I love Delta. Yeah, they're the
Yeah,
best.
Delta's done pretty good, but in the past, that was their motto, and so they've really had to put a lot of infrastructure in it. And I can tell you right now that we all have to improve our game when it comes to the client experience, because they're now choosing, and they can travel anywhere through Zoom, as Shani mentioned. And so their choices are endless, but what people are really looking for is more of a luxury experience in healthcare. The ones who really have embraced 2022 and beyond. And so what we're doing is we will be sharing these principles coming up in session 2. But we're also going to have a special boot camp where we're going to train your whole teams on this, and that will be kind of mid-July. So we'll be releasing that very soon. So should we jump into some of these core principles?
Let's do it.
Yeah.
All right. So very first thing, if you look at Ritz-Carlton, their basic mission statement is to inspire life's most meaningful journeys. And they do that by being inspirational and by prioritizing meaningful journeys. So it makes sense. In the Go Wellness, in the 22 model and beyond, our core, what we do at Go Wellness, just so you know, is we create lifetime healthcare practices that increase entrepreneurial relationships, entrepreneurial freedom, and entrepreneurial purpose with innovative and collaborative medicine. So our vision statement is at Go Wellness is lifetime clinical leadership, practice enjoyment, and meaning in delivering integrated healthcare. We do this by being inspirational in relationships and prioritizing lifetime relationships with world-class healthcare. So thoughts on that, Annie?
Oh, I just love that so much. I feel like it's such a beautiful thought, because I feel like now is a time where like we get to have like the relationship, we get to be a part of the medicine, doctor and patient. Like before it was like this turn and burn service. You go in, they tell you what to do, they leave. And now it's like, I mean, part of healing is the patient too, and their connection to the process and their investment. And so if you like lay out this like beautiful experience for them to keep them inspired, keep them educated, keep them excited about what they can do, like the sky's the limit. Like that's true healing, is this like partnership. I think it's
Totally. Well, and that's where, we're moving into these lifelong relationships. So lifetime patients, you want somebody who can always have confidence and clarity that they're progressing in their life, because what's happening is fewer and fewer people are having babies, our population's declining. And so now we're going to have to bring in regenerative medicine. We're going to really, if we're going to weather the storm in 30, 40, 50 years from now, we're going to need a lot of people in the workforce and providing value to the marketplace who are in their 80s, 90s, 100s. And we can do that if they're healthy. If someone's not healthy, they get taken out of the marketplace very quickly. And that's, it's not good for society, and it's certainly not good for the human soul to not be useful. So the whole new framework is around lifetime relationships. You can't do that. Ritz-Carlton, like, I've never stayed there. I've stayed at Four Seasons. And so they have they're similar models. But once you go there, it's really hard to go back. Like I can do Airbnb because I know that I just get the house or whatever it is, or I can do like Four Seasons, but it's really hard for me to go like to a Marriott or to, Marriott does own Ritz-Carlton, by the way, but it's their exclusive 5-star. So so as we're thinking about this, the whole goal is let's provide that experience that people want to keep coming back to over and over again. So that's where, be inspirational in relationships, because that's the number one thing in any line of work you're in. Is it's all about the relationship, and then prioritize lifetime relationships with world-class healthcare. So our core values are curiosity, innovation, transformation, integrity, and collaboration. And then what the Go Wellness cohort is it's a community of leaders who develop a balance of holistic medicine with breakthrough innovations within a 5-star patient experience. So Anna, and Shani, what does that look like to you? If you're providing world-class healthcare, but you've got this really cool balance between holistic and innovative medicine, but a 5-star patient experience, what does that look like from a patient perspective?
Well, for me, I mean, I see it as this beautiful ability of being proactive and not reactive, like Western medicine has been for so long. And I'm such a spiritual person and I'm very much a believer that that is a part of the experience of healing, is you're having all of those elements, mind, body, and spirit all together. And so bringing in the holistic aspect and the Eastern side, I mean, it's just, healing is so involved and it has to evolve. And I feel that's what we're doing. I feel like that's what's happening.
Yeah. Oh, go ahead, Annie.
Oh yeah. And just on the opposite side of that, like on the provider side, like there's a million providers out there, right? And like the thing that's setting us apart is like this connection we're able to make, this trust, this vision of the future. So if we can create like this all-encompassing experience as a provider, get the right message out there to our patients, to our future patients, on like why we're doing what we're doing, and connecting with what they already know they need to do, like the sky's the limit. Like how beautiful is that? Like this is where we've been needing to go forever. So it's cool.
Yeah, and if you look at it, one of the things that just really like struck me is in 2021, it was this was published in the Berkshire report, and they found 61% of doctors were burned out. 61%. Now, the same year, the RAND report released data showing that over 60% of United States adults, I believe it was adults only, but 60% of adults in the US have at least one chronic disease. So if you look at that, it's like, well, man, we got the sick treating the sick, and it's a sick system. And so now with what happened in 2020, 2021, we're at a renaissance in healthcare. And so many people are getting left behind because they're trying to go back to the old way of doing things. And that old way of doing things is run its course. Like we've got to evolve as clinicians and as entrepreneurs. And Go Wellness is that community that we're sharing with you guys how to do it, because it's never been easier. But what I'm saying is there's also never been more resistance for people to change. It takes a lot of momentum to get there. But I can tell you, if you start implementing your wellness programs, the Accelerate Wellness, you start getting peptides into your protocols, you start doing more innovative therapies, and couple that with the holistic side, like Shani was talking about. Maybe this is, you have a subset of ketamine therapies and psychedelics, or maybe you bring in a shaman, or you at least have some type of healing modality in there. This is where medicine is going. So we'll keep going. So Go Wellness, what we do as a cohort, and this is each of you as members of Go Wellness, is we pledge to deliver impeccable care that inspires patient transformations and lifetime relationships where they always enjoy a warm, relaxed, yet intentional experience. Does that resonate? So think about that. I mean, and Annie, you were in the clinic for years. And so, it's something we've always been delivering. We do create that nice warm experience where people get that, warm, relaxed, yet intentional. It's like, here's where we're going to take you. Here's what we need to do.
Yeah, you have to. You have to spend the time to do that. And and providers who don't are doing themselves and their patients a disservice. Like healing is so personal and so scary for so many people. Like change is scary. New environments are scary. Like we need to be able to offer them the platform to go into somewhere safe, to be with someone they trust and have this beautiful transformational experience. And every part of that matters. The provider, the person at the front desk, the surroundings, the music, the lighting, like it all, it's this just transformative experience. You have to like, get all the senses involved.
Hey everybody, Reagan Archibald here. I hope you enjoyed the Go Wellness show and maybe learned a couple things you could apply to your practice. If you're a healthcare entrepreneur who wants to work in an academic think tank with like-minded humans who are just like you, looking to provide better service, better quality of care for your patients, reach us at info@gowellness.com and we're happy to do a free practice analysis for you.